Hello, everyone. I'm Ellen Anderson. Today, I'm discussing pediatric anxiety conditions. Pediatric anxiety conditions encompass a range of disorders in children and adolescents that involve excessive fear, worry, or nervousness. These conditions can significantly impact a child's daily life, including their social interactions, school performance, and overall well-being. Pediatric anxiety disorders typically arise from a combination of multifaceted etiological factors, including genetic predisposition or family history of anxiety disorders, which increases future risk, brain chemistry and structure, or imbalances in neurotransmitters and differences in brain structures that regulate emotion and stress responses. Environmental factors, such as stressful life events, trauma, and learned behaviors from anxious parents or caregivers, which can contribute to the development of anxiety disorders, and developmental factors, such as certain temperaments or personality traits in children, like shyness or behavioral inhibition, which can predispose them to anxiety. Each anxiety disorder exhibits its own distinct etiological differences and characteristics and can significantly impact a child's functioning and development differently. Understanding these aspects of each disorder is important in the development of effective occupational therapy interventions and for mitigating long-term consequences. Generalized anxiety disorder, or GAD, is marked by excessive, uncontrollable worry about everyday things. Children with GAD often struggle with constant fears about the future and a sense of dread about potential negative outcomes. It could stem from genetic factors, or brain chemistry, or environmental influences, such as overprotective, anxious, or enmeshed parenting styles, or a combination of both. Children with GAD may struggle with school, social interactions, and daily routines. Occupational therapy can help them develop coping strategies and organizational skills to manage their anxiety and increase independence. Lacking intervention, children with this disorder are at a higher risk for developing chronic anxiety and depressive disorders in adulthood. Separation anxiety is common in young children, but can be a significant concern when it persists. This disorder involves intense anxiety surrounding being away from home or primary caregivers. It often originates from early attachment issues or life changes like moving schools, generally moving, or divorce. Occupational therapists work on gradually increasing a child's tolerance to separation, aiding them in developing self-soothing techniques. OT can help prevent the negative developmental impacts of this disorder, such as social development delays and spotty school attendance. Long term, without intervention, this disorder can lead to difficulties in forming future independent relationships. Social anxiety disorder involves a deep fear of social situations, worrying about being embarrassed in front of or judged by others, potentially leading to social isolation or limited social skill development. Factors like genetics, social experiences, and learned behaviors from parents can contribute. In OT, we focus on building social skills and confidence in group environments, allowing children to participate more fully in group settings and community activities. Left unaddressed, children with this disorder face higher chances of continued interpersonal developmental difficulties and potentially limited careers. Specific phobias are intense, irrational fears of particular objects or situations, such as animals, heights, or flying. They could result from a mix of genetic predisposition and triggering events. The fear is disproportionate to the actual threat and can cause significant distress and avoidance behaviors. OT includes very controlled exposure therapy and desensitization strategies to help children overcome these fears, which can limit their participation in normal activities. Although less common in children, panic disorder in children is characterized by unexpected and intense repetitive panic attacks, or intense periods of fear or discomfort accompanied by physical symptoms like heart palpitations, dizziness, or shortness of breath. It might have genetic roots or be triggered by stressful events and changes in brain function are involved. OT focuses on recognizing and managing triggers and employing relaxation techniques as well as coping strategies. Developmentally, this disorder can impact school attendance, participation in activities, and can severely impact quality of life. Left untreated, children are at increased risk of developing chronic panic disorder or social avoidance in adulthood. Obsessive compulsive disorder, or OCD, involves repeated, unwanted, and intrusive thoughts and compulsive behaviors the child feels driven to perform. These behaviors are often carried out to prevent or reduce anxiety related to the obsessions. The blend of genetic, neurobiological, and environmental factors can contribute to its development. Occupational therapy aims to help children manage their compulsions and improve their daily functioning, reducing the impact of obsessions. OCD can significantly disrupt daily routines, schoolwork, and social interactions. Without intervention, OCD may persist into adulthood, affecting interpersonal relationships and potential for employment. Post-traumatic stress disorder, or PTSD, follows exposure to a traumatic event, or in the case of CPTSD or complex PTSD, the continued and repetitive exposure to traumatic events, leading to symptoms like re-experiencing the trauma through flashbacks or nightmares, avoidance, and heightened anxiety. Occupational therapists work on stress management techniques and support children in re-engaging with daily activities and routines. PTSD can impact a child's ability to trust others, sense of safety, and emotional regulation. Unmanaged, long-term children are at increased risk of other mental health disorders, social and occupational difficulties. Developmental impacts of untreated anxiety disorders are profound. They can hinder a child's ability to form friendships, succeed academically, and regulate their emotions effectively. If not addressed, pediatric anxiety disorders can evolve into chronic conditions, affecting an individual's ability to form relationships, succeed in their career, and maintain a good quality of life in adulthood. OT aims to enhance a child's ability to participate in daily activities. In the context of pediatric anxiety, OT evaluates how anxiety affects the child's participation in school, play, and daily routines. Intervention strategies might include teaching coping skills, sensory integration techniques, relaxation methods, and cognitive behavioral strategies. Adjusting the child's environment to reduce anxiety triggers and support engagement in activities. OTs work with parents and teachers to create supportive environments and strategies. Thank you for listening.